one thing that really caught my eye was a line in a PowerPoint presentation by the State Department of Mental Health about the fact that it took an average of 19 calls to find a inpatient psychiatric bed in Michigan. When I'm reporting on something like this, I'll try to find someone, the person I know who really knows a lot about that topic. I actually knew someone who, Tom Watkins, he used to run the Department of Mental Health in Michigan, so he was obviously a great source, and said, from your perspective, talk to me about this issue. When American modern medicine system was created, mental health was taken and put in a separate category. It was segregated. I mean, and it's still segregated. You look at the state budget, and all the other health needs are in one budget, and mental health is in a separate thing. Insurance companies treat it as a separate category. The reality is that mental health coverage is very expensive. I mean, a lot of times you're talking about people with chronic conditions, the services are expensive, and it's a question of money. In the case of psychiatric services, Medicare actually pays more than private insurance. So that tells you how poor the reimbursement rates are. I mean, the government reimbursement rates are pretty poor, but the private insurance is even worse. That explains why you have a shortage of mental health professionals. If the reimbursement rates are low, that's not a field that people would honestly want to go into. So the result is that you have a long waiting list, particularly if there's someone who is high needs. And that could be someone who is maybe aggressive, but it also can be someone who requires a lot of staffings because, for instance, they have other medical needs. It's a particular issue for children because they require special settings. Even though there is this shortage of beds, on a given day, about 25% of those beds are vacant. But that's because of the staffing issues and because of this mixing and matching issue. I really, really would like to ease the stigma of mental health. Having a broader array of services and a broader spectrum is going to require more money and more resources, but this is a pretty fundamental health issue for a lot of Michiganders.